with us today. I think it's my job to welcome you all and also to give a very brief overview of what's going on our campus with regard to preparing for fall. We're going to have several brief presentations and then and Stacy DeLorenzo is going to be moderating us. But I'm very, very pleased to be joined by some of our wonderful deans, Jane Thorpe, Anand Hyder, and Natasha Kazeem. And so I'm just going to begin and quickly give you an overview of what our plan for fall looks like. And this is a plan that was submitted to the District of Columbia. We still don't have the letter from the mayor, but we've been working through a lot of things with them. The idea of our planning effort across GW has been to be comprehensive, to be inclusive, that we're thinking about the needs of all of our students, faculty, and staff, and anticipatory, that we know that there are a lot of unknown unknowns. We do not really know how the pandemic is going to go, either across the country or in DC, and what all of the needs are actually going to be as we go into fall. So the campus has decided to take a number of prevention measures that are really important, modifying the academic calendar so that the students aren't going back and forth for fall break, for Labor Day weekend, for Thanksgiving break. They stay with us until Thanksgiving and go home. Widespread testing that I'm going to talk about a little more, social distancing in our on-campus spaces, cloth masks. This is a DC requirement. We will require it. Hand sanitation stands and wipes, seasonal influenza immunizations. We're standing up a program to immunize virtually everybody, and a daily symptom self-screening that all will be asked to do. So social distancing is going to be a very important part of the approach. All the classrooms are being rearranged. The dorms are being de-densified. They're still figuring out how to do that. That is an ongoing effort right now. Even as I'm talking, there are people working on it. Public health signage to remind people about that. Extending the move-in period so everybody isn't converging on the dorms at the same time. Limiting gatherings. Reducing the riders on the shuttles. And actually the Atlantic 10, led by our own athletic director and alum, Tanya Vogel, they have decided not to play games this fall, which I think is very wise, and I know Tanya had a big role in that. Many other health and safety measures in terms of enhanced cleaning protocols. Most of you would say there was nowhere to go but up across our whole campus. Addressing ventilation and water systems and other systems that can either be involved with spreading the virus or help us dilute the virus, telemedicine and student health, and the MFA, restricting public access to campus buildings, and providing accommodations for people at high risk. This is very important, I know, to many of our faculty and staff. The fact that is, though, that our number one priority remains care of people in our community, and that means providing that. And we're minimizing travel across the national capital, outside of the national capital region. We're planning that any residential student who tests positive for COVID-19 will go into isolation. And when we have persons under investigation, we will be quarantining them. We, Public Health, are helping to stand up a campus COVID support team that will be guiding the university in this. And if we monitor resurgences, we will be increasing online instruction, telework, and probably taking other actions as well. So the safety and security people are going to be creating kind of a dashboard that in simple terms will be guiding where we are at any point in time and how we're managing the risk across the campus between level 3, 2, 1, where we have extreme distancing, 0, where everything could go virtual. And resurgence information will be provided, in summary form for people across the campus. And what I mean by in summary form is in a way that protects the privacy of individuals, which is going to be very important. So there's a lot of guidance that's being developed. a commitment that is being written that everybody coming back will have to attest to, commitment to health and well-being, as well as a campus health and well-being policy, and a lot of self-directed user information for our students, faculty, and staff. So we're all personally responsible. The campus has responsibility, but we're all going to have to make clear commitments to things like wearing masks. So our testing, I know some of you are curious about this, some of you heard about it probably on Friday, but we want to identify infections early, assess the prevalence over time. And we are talking about mandatory viral testing for everybody who's on campus. And by that, it's students, faculty, and staff, including contractors. And that we're talking about testing upon arrival, 3 to 5 days later, and periodically. And those of you who understand the virus might understand why those time intervals. The choice of the test that we're using is a nucleic acid amplification test called a PCR. That is a laboratory-based method. We're not buying a commercial kit. We have very high levels of sensitivity and specificity with our own lab-based tests and the point-of-care tests and the kits that are out there. And also we can assure our supply chain and turnaround. If you send things out to commercial labs right now, it might take 7 to 10 days to get a result. That is not going to help us to manage this public health crisis. So the testing timeline in terms of starting the semester COVID-free, we plan to do viral testing at the beginning of the year, as I said, on arrival. This says 1 week. Basically on arrival and 3 to 5 days later. Possibility of some initial quarantine for some who are arriving. We're still working that through with the city. And then periodic surveillance testing of perhaps more intensively on undergraduates and people who spend time with them than on graduate students, faculty and grad students who don't teach the undergraduates and others. We're still working through, kind of the pacing of that, and definitely would think we need to step up the testing if we have resurgences or if our metrics are just going the wrong way. We think that this method will cover all the areas of the campus, and that we certainly have ways to focus in on specific subgroups if we need to. Symptom monitoring is going to be a part of what we're doing. Everybody on campus is going to be asked to daily monitor their symptoms and their temperatures using a module for something called point and click that is part of the electronic health record for Colonial Health, but can be made available to everybody. And we're working with PNC right now to adapt it to us. And also the test results will come back to people through PNC and, not through non-confidential means like messaging. It's very important to us that we're maintaining the confidentiality of those results. People with symptoms that, if they're monitoring, will get a ping from point and click that they need to maybe make a telehealth appointment, make a symptomatic testing appointment. Our public health lab can do the testing within 24 hours, get you test results rather within 24 hours, and will not charge you, by the way, at any time for any of the testing. So the antibody test will also be used by us once at the beginning of the semester, once at the end. The point of it being to tell us about the total amount of prevalence that happened over the course of the semester. So it's a broader monitoring, but I think important to us to understand. So somewhat more detailed information, all of this testing will be performed in a CLIA high complexity lab that we've already got the CLIA approval for. We are moving into that lab in SEH tomorrow. We're starting to move in. We're hoping to have it operative by the end of this month. That's if, all of these stars are aligned, in terms of hiring, buying everything, getting, it's a lot of moving parts right now to bring that lab together. Its capacity for PCR is 7,500 pooled tests today, meaning that we're going to do this in mini pools of 5, and that there's flexibility in terms of multiple specimen types and multiple assays that we can use if we have supply chain issues. The antibody test will not be pooled, has a capacity of 1,500 tests today, and uses an ELISA just to find the specific IgG. Case follow-up by the campus case support team will coordinate heavily across, the CARES team at GW, student and occupational health, DC health, follow all of the rules in terms of immediately reporting every result to DC Health and working with their contact tracing team. And we're currently hiring the CCST staff, working on data flow and coordination with stakeholders. Data integration is going to be really, really important, not just from the LIMS, but also the point and click system. And, there are a number of data domains that we'll be trying to track, not only the guidelines that DC uses, but, just monitor our testing, transmission and disease burden are at any given point in time, if that's going up, that kind of thing. Syndromic surveillance, how many of those are coming through? The availability of resources. If we begin to exhaust our resources, we might have to pivot, change our strategy. Case investigation and contact tracing, and of course, detection of outbreaks and action that will need to take by the university if there are activities on or around our campus that are contributing to outbreaks. And we have a lot of resources on our webpage. I want to, thank Stacy DiLorenzo and her team for this beautiful website. It really does provide a lot of, if you click through it, a lot of information about and this, by the way, is a homepage for our school, so I hope you can find it. It's right off of our school homepage. So please, please, there are a lot of questions that you can address there. And I am done with my presentation, but I should say that I have, an enormous amount of thanks and appreciation to people all across our campus who we've been working with, the coordination with medicine, with all the offices, whether it's finance and administration, has just been incredible. And in particular, some of our faculty, Dr. Wu, who's worked day and night on this since the beginning of the pandemic, Dr. Castell, providing great epidemiology support, Dr. McDonald, Dr. Vias, Jean Migliaccio, all of them have committed so much of their own personal time and resources to various aspects of this, including Jean helping to coordinate the operations team for health and safety around the reopening. So thank you very much, and turn things over to Stacy.
Thank you, Dean Goldman. We had a couple questions come in so far. One from Zoe Beckerman. She wanted to know if you could explain what the levels really mean and what is extreme distancing.
I'm not sure what she means of levels by what. So, but extreme distancing is that what basically we're following the CDC guidelines around everything is 6 feet apart, whether it is, seats in classrooms, places in line, or whatever. When it comes to dorm rooms, it's a little more than that. So, it's like eliminate the bunk beds. You can't have beds right next to each other and things like that. We're fortunate with our dorms that we have dorms that are kind of apartment style. And a lot of us, when we think about residence halls, think about the aggregates, the congregate settings that we had, in our colleges where, 20 people shared a big bathroom. We don't have many like that, but we have had to, in order to reduce density, we've had to deal with some of that.
And what Zoe meant by the levels is the levels that the university has decided to use, 1 through 3 on one of your early slides.
Yeah, so you can go to the safety and security website and actually see that all kind of laid out in detail. And rather than doing that, I would ask you, to take a look at that. But basically, it very closely tracks DC's guidelines. So at certain levels of reopening, you can have, for example, right now only 10 people in a meeting. At the next level, there's 50. So it has to do with the size of gatherings that are allowed, as well as the requirements for social distancing and wearing masks, and a number of other issues that like around how behavior in dining places and all kinds of things. Um,
Okay, I'm going to switch to a question that Dr. Tilch had, and that is if you could comment on the recent changes that the DC government has made for reopening.
They haven't, it's not an official change, but we are in negotiations with them now about the fact that it has popped into their heads that there are parts of the country that are having more transmission than we have in DC. I should say we're having more transmission in DC this week than we were having 2 weeks ago. We were below 1 and we were seeing a slow decline number of cases. Now we're slightly above 1. That concerns me, it concerns everybody. But in particular, they have ID'd that, this week, there's several states that they're nervous about. And those are Florida, Texas, Louisiana, California, and Arizona. And they are asking us, could we do something special in terms of when the students arrive from those states that they are quarantined, and before, they're released into the community. And so we're talking to them about that. I mean, a thought that I've had anyway is that, that is a measure we might want to take with everybody. And I'm certainly urging that we think about that as an option, because the other thing they said, there might be different states by the time people are coming back. I agree with that. It might be completely different states. So, and to be honest, as somebody who is a child of the West, the idea that a state like Texas is a hotspot is ludicrous. And so I took a look at our students coming from Texas and their zip codes and what's going on with the pandemic in their zips. And some of them live in counties that have had exactly 0 cases. And it's hardly true that they live in a hotspot. And others of them live in Houston. And the same is true with other big states, Florida, California. There's a lot of variability in terms of what's going on in those states. But we're working through that. We are trying to negotiate with them around our ability to do that. And I think we could put them first in line for the testing. And maybe if they have 2 sequential tests 5 days apart and they're negative, that we don't have to quarantine them all 10 days. I think since this is not actually an official CDC quarantine, it's not based on a medical indication. I mean, if it were a public health indication, they would be quarantining everybody coming off of that plane from Houston. But no, they will want us to quarantine the 5 that are coming to our school, and all 145 other people will just be able to disperse right into the population. So it's a public health measure that does not 100% make sense unless you think that, people in their 20s are specifically targeted for being infected, which I do not actually believe is true. So, and the data doesn't show that. So.
Okay, great. We have a couple questions on testing, Dean Goldman. The first from Dr. Manya Magnus, and she is asking that, are these NP swabs for PCR? And if so, who's doing them and where? Because she is concerned about the social distancing, and is suggesting that self-collected nasal swabs could possibly be used as an alternative as well.
So I will answer, self-collected is definitely where we want to go, because we don't want to exhaust the entire world supply of PPE just by testing our community. And also because of what you said, just bringing people together, even if you're in, and for the symptomatic testing, we're using the Smith Center. We have to have a place to do that. But I think that, we're going through issues around how do we train people to self-collect. Dr. Liu's lab is using a mid-turbinate collection. It's not deep. It's not really hard to do, but some people are very squeamish about it. That's what we're being told, so we're also being asked to look at saliva as an alternative, even though we know that saliva is a little bit less sensitive than or it might be. And so the lab is working on not only setting itself up, but also getting these things called EUAs. And so we have to get emergency use authorizations, both for the PCR test itself and for the swab collection method, whether it's spit or NP swabs. The other thing I should say, the NP swabs we're using, that Dr. Liu's lab has been able to devise a way to get those so that we kind of aren't screwing up, the supply chains that they use in places like the hospital and stuff.
So the other quick question about testing, Dean Goldman, is can family members be tested through GW?
Well, so we have not been planning that our public health laboratory that's set up, for testing our community would be available for family members. I've also been asked about members of the community. What about the people who live right around, the university? We haven't really been, gearing up for that. I think that family members certainly could go through, the screening sites that are operated by DC and all of that. I mean, we're also not making it available for the people who live off campus who are not going to be on campus, people who are teleworking, just teaching online, only studying online. We're not planning to include them in the testing. It's really about the trying to keep avoid the transmission on the campus, but we're not trying to deal with the transmission all through the community. If a family member is a contact of somebody from GW who is a positive, then immediately, I mean, within 24 hours, according to DC Health, they will be contacted, and hopefully the contact tracing will result in a very quick bringing that person, into that testing regime. The problem being how long it takes sometimes, to get those test results back, and we understand that.
And then Dean Goldman, and this may be a question that Dean Kazeem wants to jump in on, but the question is, will the access to the SEH be restricted to authorized users only?
I'm going to let Natasha address that. I think it's on her slides, so we should kind of color.
We'll come back to that then. Very good. It looks like that is the last question for this round, so I will hand it back to you, Dean Goldman.
Thank you very much. And I believe that who is next is our Senior Associate Dean for Academic, Faculty, and Student Affairs, Jane Thorpe, who has really been extraordinary over the last few months in working tirelessly to figure out how to support all of you and our students and everybody else. And I just want to thank her right now for all of that effort. Jane, take it.
Thank you, Dean Goldman. That's very much appreciated. And thank you to the incredible team across the school that we really have working on all of these issues. I'm going to pause a moment and share my screen. Oops, let's see. Oh, it's not moving. Let's see. There we go. Okay, apologies. What I'd like to do briefly this morning is just give you an overall update on where we are in terms of academic affairs in general. But I just want to thank everyone. This has absolutely been a team effort across our faculty, staff, and students. We have continued to prioritize the health and safety of everyone. That is absolutely the first priority in all that we do. And obviously our continued commitment from students and faculty to an in-person hybrid learning format in line, of course, with health and safety guidelines. And this means flexibility in terms of our options, in-person and hybrid or fully remote, really focusing on continuity of instruction across all of these modalities, and of course, preparing to pivot if conditions require and what that might look like. I'm going to give you a brief overview of our students and faculty and what we're hearing and learning from them, a brief update on the academic calendar. I'd like to share with you more information about classroom technology and capacity, and then finish up with training and resources information. Before I jump into that though, I did want to take a moment to just literally take stock. We have come so far since March when everyone departed to home, and I just huge gratitude to all of our faculty and our staff and our students. We have pivoted since spring from an instructional continuity mode where we were disrupted mid-semester and moved fully remote. We've launched an entire summer semester with fully remote teaching across all of our courses, residential and online, of course. And then we look to the fall, we're looking at a combination of hybrid and remote instruction. And I'm really pleased, I think I can confidently say that we as a school continue to be a leader in all of these modalities. And we've really been able to rely on depth of expertise and experience across our faculty in particular as we have moved forward with these different modalities. We've done some surveys of our students trying to make sure that we are staying in touch with their needs. Obviously, they have a range of issues that they're addressing, academic, of course, but also personal and professional. We continue to hear that they would very much like to see as many of us as safe for in-person classes. So obviously the undergrads, I think are about the highest percentage, more than 85% of them continue to share with us that they would like to be in person for their classes, again, in accordance with health and safety guidelines. With our master's students, slightly below that, more than 70% of them still affirming to us that they would like to be in person. Our doctoral students to a lesser extent, but still would like to have in-person opportunities, again, should conditions allow. I'm thrilled to share with you that our enrollment continues to grow. We are looking at the largest incoming class for our MPH at GW program this fall since the inception of the program. There is great interest in public health for obvious reasons right now, and it's really incredible that our school has such an amazing reputation and resources that we are able to lift up the caliber of education that we do, and really to a group of students across the country through our online program in particular. But I'm also happy to share that enrollment in our residential program is also slightly larger than it was last year, and we've of course been watching this very, very closely. But we are actually pacing for slightly larger enrollment than last fall. And I will share with you that we have done an incredible amount of ongoing engagement with our students. We've been doing town halls, office hours, engaging with them, and our international students, our undergraduates, as well as our graduate students directly. And it's really been met with very positive feedback. And I want to also thank all the faculty and the staff, as well as the leaders of our student organizations who have played key roles in those outreach efforts. We will continue to do that, especially as we get further into July and early August, as people are really starting to make final decisions about things like leases and moving, etc., working with them closely on a host of issues. In terms of our faculty, I wanted to give you a quick snapshot of what we're looking at in terms of our residential courses in particular. Most of our faculty are currently planning for the in-person hybrid format, and I'm really thrilled to share with you shortly some new workshops we're going to be launching to help support you in doing that. We're also looking at around 11% or so of our courses that are planning for a fully remote presence. And I would like to let folks know that those courses that will be fully remote are now being noted on the Master University course schedule. So students are able to see those courses that will be offered fully remotely this fall. Our plan is to provide each of our faculty teaching this fall with a course list that will identify, for those of you teaching in person and hybrid, who you will anticipate seeing in class and who you can anticipate to be remote. And I also wanted to share with you that we are tracking closely our peer schools, and most of them are continuing to plan for hybrid models as well. So we're just watching that, and of course hearing from our students as well on what our peer schools are doing. But our plans, our hybrid plans, seem to be very much in line with what we're seeing our peer schools do as well. There is a process in place for accommodation requests. So if faculty, due to either health conditions or other reasons, need to submit a request for accommodation for a fall, that process is available. That information, those forms have been shared. I would suggest if you're considering this and you haven't already had a chance to talk to your chair about this, especially for Category 2, please do so because we're really trying to get as firm a handle as we can, given current circumstances, around course status, and wanting to make sure that we can give everyone as up-to-date information as possible in terms of, again, who you can expect in the classroom, who may be remote, and what courses will be fully remote. We will also be sending later today information to our GA and GRA students about their packages. There's a similar accommodation process in place for them, and we'll be sharing that with them directly. As Dean Goldman mentioned, the fall academic schedule for fall is adjusted. We still will meet. The first day of classes will be August 31st, Monday. Classes will be held on Labor Day and fall break. The focus here is to think about compressing that in-person hybrid experience into the first 12 weeks of the semester. So really emphasizing that time and that use of that time for in-person engagement, activities, coursework. Major assessments are now scheduled for Friday, November 20th through Tuesday, November 24th. And what major assessments means is really large exams that are designed to cover a large portion of the content of the class. This is particularly relevant, I think, for our undergraduate classes that typically have more traditional large final exams. The university is asking that those large major assessments be conducted prior to Thanksgiving. And then after Thanksgiving, all courses, all course activities will be fully remote, but you may still have graded activities. So for example, if you're planning on a paper or presentations, it is perfectly acceptable to continue with those post-Thanksgiving with those graded activities. They're just asking that no major assessments be conducted after the Thanksgiving holiday. In terms of classroom technology and capacity, we've been really busy, and many thanks, frankly, to Regina Scriven and Andy Wiss in particular, along with George Gray, really launched, I think, a great platform for technology in our classrooms. There will be new computers in the classroom, new mounted ceiling cameras and microphones, and technology carts for the lab spaces. Our vendor, who is only serving our school, is currently in the building right now. They started last week, and they're making good progress. So for those of you who may have been in and out of the building, you may see cables and wires and boxes of equipment. So that process is moving along on the time frame that we had planned. We are hoping for complete installation around the first week of August. And then we are also building out both web-based and in-person training for early to mid-August. What we want to be able to do is share with you both virtual resources to help acclimate you to the new technology in the classroom, but also then bring you in small groups so that you're able to actually see what the technology looks in the classroom and engage with it prior to your first day of class. We are closely looking at the capacity of our classrooms as well. All of the rooms in our building have been measured and assessed, and we have been coordinating with the university on this as well for final approval. But it's looking like most of our rooms in 950, the A, B, and C rooms, will allow for approximately 50% capacity with some variation. The fact that the seats move has actually given us greater flexibility with those spaces, and so that's been an advantage for us. And then our auditoriums will be substantially reduced, approximately 10 to 15% capacity. And that's actually good for us as well, because early on, I think the university broader community was looking at some of our auditoriums and thinking that perhaps they could use them. And of course, we want to be good partners, but we also want to make sure that we are taking care of our students and our faculty. But because of the seating arrangements in those larger rooms and the fixed seats, they actually have smaller capacity, and they're frankly of less interest now to others across the university. So we're going to be able to use our auditoriums fully and are really preserving our space and our capacity for our faculty and our students. On Monday, I hope you all received an email. It came out from Monica Parch, but we will be recirculating it after this meeting and also including it in the source. I'm really happy to announce 3 brand new workshops that will be led by Dr. Andy Wiss, our Director of Online Learning. The first one, as you can see, is focused on planning your hybrid course, and we'll be offering 3 sessions of this workshop. We'll also be recording the information part of it, but during this session, you'll be given an overview of how to select the right model for your hybrid course, how to think about creating a meaningful learning experience for you and your students, how to be ready to pivot potentially, of course, knowing that after Thanksgiving, everything will be fully remote as well. The second workshop, and you can see there are 2 sessions listed for that, will be on selecting and using specific GW and GW School Public Health tools in classroom space. And this will again be focused on the hybrid classroom setting in particular, but also looking at synchronous meeting tools, asynchronous tools and capabilities, and of course working within our newly renovated classroom spaces. The final workshop will be focusing on offering a fully remote course. We know some of you will be teaching fully remotely, and you may or may not have had experience teaching in an online form before, and so we want to make sure that we lift up 2 workshops that will really focus on a fully remote course, and again, hosting and delivering that class and how to think through successful teaching strategies. Once I'm able to get back to the chat, I actually will post the registration link for that, and again, we will recirculate that after this session this morning. I'm also happy to share that we have been able to very quickly acquire access to a new tool that will be embedded in Blackboard. It's called Panopto. Those of you who may teach in the School of Medicine and Health Sciences may recognize that tool. It's basically a self-recording tool that is really highest in class, that will enable you to record content and post content either prior to your class or as you go through the semester, frankly. So more to come on that in terms of training and resources, but we're really thrilled to be able to make that available quickly to you in terms of fall planning. Most of the materials that you see here we have already circulated, but again, we will circulate them again, and they do live on the source under the Instructional Continuity Resources tab, but they include remote teaching workshop slides, synchronous platform explanatory materials, recordings of several show and tell sessions that were led by some of our super users on our faculty. Many thanks to them for doing those sessions. And we also have a team of faculty super users that are available to help as well, provide any guidance or just to talk through any issues that you're thinking about as you're thinking about your courses for fall. They're all also resources offered through the university. I think some of you have actually let me know that you've participated in the GW Flex teaching camps. These are 2.5-day sessions, and there are actually 2 more scheduled for August. And this information is also available in the guidance that we've circulated, as well as we will recirculate post this session. And of course, the GW Instructional Core and the GW Lab also are available for faculty as well, and they have been lifting up additional resources as they're trying to support the entire university as we're thinking about the in-person and hybrid format in particular. Finally, and again, we will be posting this far and wide. Who do I call? Who do I email? If I have questions, I have issues, please don't ever hesitate to reach out to me, George Gray, Andy Wiss. We are all here, and if we can't help you, we can connect you with folks who can. And again, many thanks to Andy Wiss in particular, who's leading these workshops for us. Also, our own school IT, again, as I mentioned, Regina has been incredibly helpful and instrumental in helping us lift up our classroom technology in particular, and of course, including the reference contacts for a university IT as well as instructional technology. So that concludes my slides. Happy to take questions, and of course, please don't ever hesitate to reach out to me. I know George and Andy and I and others have been in meetings with many of you, and we really appreciate the feedback that we've gotten. As you know, we lifted up a survey a little bit ago, and we got great feedback from that and have really used it to inform the information that we're including in the workshops and the resources that we continue to develop and circulate.
Thank you, Dean Thorpe. We've got several questions in the chat, so I thought I'd go ahead and send them your way. There's a concern about the community and the anxiety around in the community for not knowing what the plan is. So the question is, are there specific metrics when we are going to pivot and what that's going to look like if we have to go completely online?
I would reference back to Dean Goldman's comments earlier about the university-wide process and the metrics that they're watching closely. You know, our school will follow the university approach and following those metrics carefully, and that will guide the decision about when and if we need to pivot to online.
And I should say that, you know, we're leading the way to helping them develop the metrics. We're forming the support team. That is actually going to be a place where we're bringing together the metrics. And so I think that we should be able to have a very honest assessment of what's going on with it. You know, so when the university is going to need to pivot and how, can't tell you, you know, because none of us know how the pandemic is going to take its course. But I would say, you know, that we're doing that right now, even as we are planning for fall. And it's part of why you haven't really seen very many communications recently. And I'm sorry for that, because I think that it's hard, you know, to go several days without hearing much. But I do think that the university is trying to really get its ducks in a row in terms of, you know, exactly how we're going to start the year and get a clear communication out to everybody, because we very much respect that our students and their families have very important decisions to make about things like where are they going to live, when are they going to move, are they going to put down those deposits, you know, for their housing and all of that.
Thank you, Dean Goldman. So along those same lines, there's a question about, is there a plan to survey the students again, since things are changing so rapidly?
I'm not aware of any specific plan except our plan. The public health team wants to do a survey to find out more about the actual behaviors that the students have where they live. There's so much of variability across the country in mask wearing and distancing, and just to understand what they're used to and whether coming onto our campus is going to be a behavior change for them or not, and what their attitudes are about changing those behaviors. So we want to deploy that. I can promise you that the university is going to want to, survey again and again and again. I'm just not aware of any specific survey that's being prepared right now, and it really hasn't been that long since we did the last one. But I'm sure that they'll be doing more surveys as time goes by.
Very good. And in terms of the classes, there's a question about, will all the hybrid classes be in Milken, or will some of them be in Ross Hall? There's a concern that Ross Hall may not have the appropriate technology.
Well, Ross Hall, like us, is amping up their technology, and actually we and the medical school are in a very similar place in terms of making the technological changes that need to be made. And if you remember what Jane said, where some of the approaches we're taking were actually copying medicine. Since we left Ross Hall, which, remember, was a long time ago, they have made several changes. That said, as far as I know, we're not planning to actually use Ross Hall at this point. It's not in our classroom schedule, not at this point.
There's a question about how many students will be, do we know actually at this point, how many students will be attending in person versus our virtual classes?
So we are working on that right now to identify students' plans. Of course, we understand that those may change, so it is fluid, but we are working to identify what we'd like to do by early August is provide faculty with as static roster as we can, again, knowing the circumstances may change, of who they can anticipate attending class in person and who they can anticipate to join remotely. We do understand for some of our larger classes, there may be more students who would like to join a class in person than the classroom capacity can accommodate. And in those cases, we will be looking at potential rotations of students such that perhaps one group would attend 1 week and group B would attend the second week. Given the volume of our classes and the capacity that we're looking at right now, we don't anticipate, frankly, needing to go beyond 2 in-person sections for any given class, but we are watching that very carefully.
And sort of along those same lines, Dean Thorpe, there's a question about when can we expect course lists of in-person and remote students to be available to the course instructor?
We're working on that right now. And again, our goal is to provide that information by early August. And we'll continue to update that as we get more information from our students. Students are, what we're finding right now is they're really starting to finalize their own plans. And of course, like our faculty, they're also managing a number of issues and challenges and thinking about what the best approach for them is going to be this fall and potentially even this spring. Because we also have students who are, of course, thinking about spring as well, as it impacts, particularly if they're moving to the area, what those plans might look like. The good news I will say is in all of our discussions with our students, they have really expressed a large degree of support for our faculty and our staff and for themselves. They're very much obviously a publicly health-minded community. And so they are, they want to be in person, but they also, by and large, are very understanding that conditions may require that we do otherwise.
And then if we have to pivot to a fully online experience, will we maintain the compressed schedule?
The schedule, I don't believe, would change. If we move to remote, we will just continue through the end of the semester, the 14-week semester as is. The only change would be we would pivot to online before Thanksgiving as opposed to after Thanksgiving.
So you mentioned Thanksgiving. There's a question about the logic. What is the logic of requiring exams prior to Thanksgiving when only half of the students in large classes will be able to take the exam in person?
That's a good question. And actually that decision, as I understand it, was informed by feedback that the university received from our students with challenges, basically, that they found when they moved to remote in the spring and then took their exams in the spring remotely, they expressed that it was very difficult for them to find appropriate areas to study, to have appropriate places to take those exams. And so this was a direct response to feedback from the students that they would prefer for these major assessments, if possible, to be conducted in person before moving to a remote platform.
So again, along those lines, course evaluations by the students are normally closed prior to the final exams. So will this also be the case in evaluations closed prior to the pre-Thanksgiving assessment period?
I'm not aware of any changes to the course evaluation schedule. I do anticipate, however, like the university did for spring, that they may adjust the course evaluation to accommodate for the period of in-person learning as well as remote learning in a similar way that was done again for the spring course evaluations.
Very good. And Dean Thorpe, there's a question about classroom capacity. How will assignments for students be made for FTF for classes that have large enrollments?
Again, for classes with large enrollments, we may have to do a rotation where we'll have sections of the course that will meet in person. And as soon as we have that additional information from our students about those who plan to be on campus and look through that information, and we will be working with individual faculty members as well in terms of what best meets the needs of their course, what the classroom capacity is, and how to think through if we need to do rotations of students within a class.
Very good. And what if all the students who are enrolled want to be in person, but our classrooms can't accommodate them?
Again, we may need to move to rotations, and we will make those adjustments as we go, and we will work very closely with faculty because we want to do everything we can to support you in the classroom, knowing that you will be in the class in real time with those students who are both participating in person as well as remotely.
Very good. So there's a question about room assignments, and the ones that are showing up on the schedule of classes, will that be the actual rooms?
At this point, I would say not to rely on any classroom assignments that are appearing in the Master University course schedule. We're working very closely with Robin Delk in scheduling as well as facilities to make those adjustments to the classrooms. And then again, the goal is to have class lists with class assignments that we will provide directly to our faculty.
Thank you. There's a couple questions that have come up here that probably Dean Kazeem will talk about in terms of sanitizing and how are we going to handle students in the building in terms of distancing. So we will wait until Dean Kazeem gives her presentation. I'm just going through. So there's a question here, will all classes at SPH be online in phase 2?
That's a good question. I don't know that, again, I think we will follow the university guidelines and guidelines, again, that Dean Goldman said, are being informed by her work and many of our faculty that are involved in that.
I think more or less phase 0 is all online, that we're not, going to have any contact at all. And I should say, I realize some of you question why in a pandemic we would do anything face-to-face, right? But we have a very wide range of disciplines that we teach. And we also have a very wide range of students who have a wide range of needs. And a lot of our faculty have the need to teach face-to-face, and a lot of our students have the need to matriculate face-to-face. None of us are forcing any faculty to teach face-to-face. I think you guys are aware of that. But nor are we forcing people at this stage not to do it, unless we move into a phase, in terms of the pandemic where we feel there is not a safe way to teach face-to-face. So I don't know if that answers that question. And of course, where we're going to be on, September 15th, 2020, I can't tell you. So
to follow up on that, are we saying that faculty will have to teach twice per week for the same course?
No, not at all. It just may be that the students who are participating in person may be different from week to week. And again, we're looking not to go over 2 rotations, but we know that there are some larger classes, and we'll be working with those faculty directly as soon as we have a better sense of what the student volume, student preference to be in person is for those classes.
So there's a question about polling the students. So Leighton Koo actually has commented that he's tried to poll his incoming doctoral students, and of course they're not getting back to him. So he assumes they're not looking at their GW emails yet, and he's wondering if we can get the incoming students' prior emails. That may be a question for Heather, but she's not here.
Let me check on that. We've been trying to post information not only via email, but also via the newsletter and posting information on the source as well. And as I mentioned earlier, Heather and I have actually been meeting with students every week, and we'll be increasing the volume of we call them office hours, virtual office hours, where we're meeting with students and trying to push as much information out to them as possible and to engage with them as much as possible so they have the most up-to-date information as well.
Dean Thorpe, I'm not sure if you answered this yet, but there's a question about large classes, like 90 students, which would not be able to be rotated over 2 days. Where will these classes be housed?
So again, that we're still working on classroom capacity, especially for those larger classes, and we'll work directly with the individual faculty members who have those large volume classes as soon as we have a better sense too of how many of those students we actually can anticipate joining us on campus.
And do we know when the master course schedule, when will the master course schedule reflect whether a class is fully online or not? Because of course, as we all know, the students are contacting the faculty quite often about that.
Of course. The university is updating that schedule, I understand, on a daily basis as they have information provided by the schools about course status. So I would encourage students to check often because I would say, frankly, in the next 2 weeks, a lot of this information is going to come together in terms of people's plans, both faculty and students, which is why we're targeting early August to have a static, I use the word static loosely, but a static course schedule with classroom assignments that we can be working from. And of course, adjustments will likely be needed. And we are trying to anticipate that as best we can, but we will move forward with assignments and in-person rotations if needed based on the best information that we have as of that time.
And then there's a final question about classes and schedule. And if faculty do not see the notation in the university's master class schedule, whether or not a class is going to be in person or remote, they'd like to know who to notify.
The registrar is updating the master university course schedule, so you can contact the registrar directly.
Very good, Dean Thorpe. I think those are all the questions for you. Some of the other questions that came in about research and distancing and all of that, we'll see if Dean Kazeem and Dean Hyder take care of that in their presentations. So at this point, I'm going to turn it over to Dean Kazeem.
Thank you.
Thank you, Stacy. I'm going to go ahead and share my screen with you all. Great. Good morning, everyone. It really feels so great to be in virtual community with all of you, even though I can't see all of your faces. It just feels very uplifting to have all of us here together this morning during a time in which, social isolation has become sadly a norm for us all. Today, I'm going to be focusing my operational updates on the following areas: facilities, our public health labs, IT, as well as HR. So yesterday, many of you have probably seen that Mayor Bowser's office updated the guidance related to masks. So DC residents are now required to wear a mask whenever they're outside their house. Anyone that will be on campus during this time will need to ensure that they are wearing a mask and are also observing social distancing of 6 feet at all times. My team has worked very closely with Jane's team in order to be able to do a mass production order of masks, cloth masks, for members of our faculty as well as our staff. We will be distributing these across all of our offices over the next few weeks. So as soon as we get that order in, you will receive a communication once those items have been delivered. The operations team has been working at lightning speed between now and the beginning of the fall semester on a number of fronts to get through the operational punch list that we have to begin to welcome our community back. I will talk about new universal signage that is taking place, and the university has done mass production of signs and on-campus printing. Some of you that have been on campus have probably seen these new signs, and Dean Goldman referenced this in her presentation as well. The signs focus on directional signage, elevator signage, where elevator occupancies are going to be 2 people per elevator, proper hand washing techniques. We, through the Strategic Initiatives Office here at the School of Public Health, we launched a proper hand washing campaign at the start of the pandemic. And what you will start to see is that we are going to take all of these signs across our schools and all of our campus footprints. We're also working very closely with facilities to dismantle the hand dryers in each of the bathrooms as well, just as a part of a preventative measure, precautionary measure during this time, as well as signage going out across the campus around social distancing guidance. There's a backlog currently in this delivery, as you can imagine, and we are likely going to receive these signs probably by the end of the month, early start of August, and we will begin the installations with that. For those of you that are on campus, SEH, the university is using the SEH building to kind of serve as the model on what every building on campus is going to look like. You will see the signs, the appropriate taping on the floor to manage space and crowding, especially in high traffic areas. And there's going to be directional signage for our stairwells, our hallways, and doors. To the best of our ability, we are also working right now on installing a push access on the front entryway of 950. So that you will not be able to use the rotational vestibule that's in the front. We're going to be managing traffic in through one door, out through another door. The stairwells on either side as well is going to only be one directional, and we will have signs as well as tape that indicates the direction in which you should be moving in and out of our areas. Moving from that, we're going to talk a little bit about classroom staging. We began to start staging our classrooms for social distancing, as well as shrinking the occupancy rates in all of our areas. You will begin to see, for those of you that are coming in, that we are roping off common area spaces in order to prevent congregating and gatherings. We are limiting the access to conference rooms. To the best of our ability, we are strongly advising that you continue to utilize the virtual tools that are available to you to have these types of meetings rather than trying to bring people in person. If, for instance, you do need to use a conference room, there will be very clear directions and signs as to how many people can occupy that space, in addition to how many, and in addition to where participants need to be seated within that space as well. We've begun the process of moving our furniture, and thankfully, with the B2 storage that we have in our building, we are not facing a lot of the predicaments that other members of the university are having to experience, where we are actually able to store our own furniture. And it doesn't get, relocated to another part of campus, another part of town for reuse. So we're very thankful to be able to have that feature within our building. I also want to talk to the faculty today about an enterprise that's been set up at the university known as the University Materials Management Store. This has been established to manage the supply chain issues that globally we are all facing right now as a result of the pandemic. It's going to provide us with the ability to be able to acquire more for the university quickly, and provides financial incentives for us that will realize larger cost savings to the university through bulk ordering. The university is working with the procurement office and facilities to manage this store, so all supplies will be delivered to colleges from this central store. The supplies that I'm talking about primarily focus on masks, cleaning supplies, plexiglass screens, hospital-grade cleaning agents, and hand sanitizer, to name a few. Our finance team will be working with all of the department admins on the process for supply ordering through this new vehicle. We are asked to basically own the supplies for cleaning as well as sanitizing in each of our respective colleges. So what we will be doing is working very closely with the department admins to understand what the needs are, ensuring that we have enough supplies for everybody to be able to maintain their spaces, throughout the day, as well as, some of our high traffic areas. We're working very closely with housekeeping, as housekeeping has had to really ramp up their efforts in terms of being able to sanitize and disinfect our communal areas. They will be responsible again for the communal areas and the cleaning that they have taken place thus far, but increasing, the level of hospital grade cleaning agents and things to that effect. But we are really going to have to take a little bit more ownership in terms of our personal areas, as well as our break room areas. So we will provide operational guidance on the expectations on how we anticipate that being done. I want to thank our community just for exhibiting the behaviors we teach and we preach. I've been in touch with many of you as you navigate the beginning of the semester and need to access your offices, and really appreciate your leadership and cooperation in mirroring the behavior, frankly, that we need the whole world to at this time. Please note, as of right now, between now and the end of August, we are realizing no more than a 25% occupancy rate in all of our spaces. Now, this is just pertaining to the summer right now, this guidance. This doesn't change anything as far as the majority of our workforce continuing in a fully remote capacity. I've received just a handful of requests from the faculty for those that want to return to campus. And all of these requests and future requests must be submitted with your department head's consent and agreement to the dean for her ultimate approval. Some specific guidance related to our locations. So regarding 2175, we are currently in discussions with the university on the broader strategy for managing our lease space portfolio. As you can imagine, the pandemic really kind of put our capitalized projects and renovations to a grinding halt. I'm working very closely with the dean, the broker of the EU, and the university in determining, given the financial implications and the operational impact of the pandemic, what is the best course of action for the school to take as it relates to managing our lease space. Questions that we're starting to evaluate right now is, should we contract our footprint in 2175? What continued investments do we need to make in our space to support our new norms, in addition to looking towards supporting a post-COVID environment? So there will be more information to the community on that as soon as we continue to get the discussions underway. In terms of public health labs, and Dean Hyder has hosted a number of e-halls on this. Through his leadership and his office's leadership in terms of providing a very seamless process towards reopening, I've been working very closely on understanding the operational context with him in partnership with review of all of the research reopen plans. I just want to thank you all again for your help in making our ability to evaluate your plans very easy for us. As many of you know, as of June 30th, Greg Davis departed as our lab manager over at Public Health. Our new primary contacts right now are going to be Bahare Sarami, as well as John Toomey, who will be supporting the efforts of the lab. We are in the process right now of taking the summer to evaluate the administrative support needs of the lab to determine if we need to hire additional support, and specifically at what level. What do our investigators need by way of school support to facilitate their operations? We will also be working very closely with our investigators to get their feedback and suggestions on how to best optimize the support from the school to the lab research environment. In terms of an IT update, Jane has talked to you about many of the large academic refresh projects that we have undertaken. As you know, and as has been stated already, we are in a 6-week project timeframe for being able to do an academic refresh of technology to all of our classroom spaces. This has been going extremely well. Our IT folks have been working with our academic technologies team at the university to be able to hopefully, what is looking like we are going to end on time in terms of this particular project. We're converting all of our spaces to learning, including the convening center. We are also working very closely with our faculty as we've bought a number of additional Zoom licenses. So for any of you who do not have one and need one, please kindly just reach out to our IT team. We have more than enough licenses available for those of you that don't have one. And we're also able to work very closely with the academic affairs team in making sure that you have the appropriate training to navigate Zoom if you need it. In addition to that, we are working very closely with our investigators who are working specifically with PHI data and those that have some challenges right now due to the pandemic in terms of accessing specific data. We're working very closely to ensure that we get the appropriate approvals to be able to move data onto ARMA, in which it will be able to be secured in a secured manner. So if you are one of those investigators that need to talk with our IT team in terms of needing assistance on this, please again, feel free to reach out to them via the link that's provided. So in terms of our HR update, we are currently observing a hiring freeze at the moment across the university. And many of you have also seen the communications related to the frozen merits that we are all observing in both the faculty as well as the staff. As a part of this context, the university has created what is known as the Resource Allocation Committee, aka the RAC, which is a committee that reviews all of our hiring decisions and personnel requests across the university. As of to date, the School of Public Health has submitted upwards of 120 requests through this vehicle. And primarily, I have to say that the only ones that are currently being approved at this time are those that can demonstrate that they have 100% research funding on them. The dean has been working very closely and advocating strongly for our needs during this time. But at the same time, we also are facing, a context right now in which it is a very clear message that we are trying to maintain a leveling of the headcount across the broader university. I just wanted to give a plug for performance management. Today is the 23rd, and this is the date in which the next level approvals are required for signups for all of your staff. Ratings are going to be going out to all staff automatically on August 7th. So I encourage you, please, if you haven't gone into Talent at GW, please try to get into it, today or over the weekend so that we can get these things done in time for all of our staff to get their evaluations. During this time, I really just want to encourage all of our faculty to take the time in your comments and evaluation, especially for our staff that have gone above and beyond during this pandemic, to acknowledge their efforts and validate them. With no merit, this is really the only vehicle that we have right now to show our staff that we see them, to thank them for their work and all of their dedication during this time. So really, I know that you all are very, very busy, but this is just my plea on their behalf to really just take the time to be able to add some meaningful value to the work that they're doing. Also want to just remind everybody, parking, as many of you as essential faculty during this time had the benefit of free parking from the university, and that expired through, that is going to expire at the end of this month, July 31st. You will need to go through the parking office in order to be able to sign up and have access to the university's parking garages. So if you haven't done that already, please, I encourage you to do that. If you do find yourself being somebody that is going to return to campus, that will be driving and will want to get access to one of the university garages. For telecommuting and other accommodations that staff may need, they may be coming to you. I and the HR team are going to be reaching out to many of the unit heads to help them evaluate some of the staffing needs that are taking place right now. But feel free, for those of you that have already determined that there is a potential that your unit, your team may likely telecommute for the foreseeable future, we can go through a process with you where we are actually formalizing those telecommuting arrangements via the telecommuting agreement for the university. And you can just reach out to the HR team in order to be able to start that process. We are also going to be providing guidance to the community via a manager's resource guide that will be housed on the source, that will provide guidance on managing essential personnel during this time, how to deal with rotational schedules, as well as a broad range of topics that are going to be covered in our SPH reopening guide as well, that will dovetail very nicely with the university's guidance that is forthcoming. I'd like to also just talk to you briefly on an update regarding the university's financial position that many of you have been aware of, related to discussions within Faculty Senate, as well as the announcements that have come out from the president, as well as our chief financial officer. Currently, the university is predicting a gap in revenue and expense close to the tune of about $155 million. And as a part of the university's ability to manage this gap, we are all being asked to contribute to shrinking this gap. The university is asking us to look at deploying a number of measures, which I've been working very closely with Meredith Enish, our finance director, under the dean's leadership, to see how we will be able to deploy these measures here at the school. Some of those include a shared service model. Particularly right now, the topic of conversation within the university is looking at shared services in the areas of communications, IT support, facilities, as well as business intelligence. We're also asked to be able to contribute through looking at this through right sizing, ensuring that we're managing our resources in line with our revenues, and that when revenues are shrinking, consequently, our expenditures within these activities are also following the same direction. Through initiatives such as restructuring, we're working very closely with the school and our academic leaders, the deans, the chairs, to determine ways in which we can maintain the integrity of our programs, continue to support innovation and excellence across all of our activities. Our enrollments are extremely strong right now during the pandemic. However, we are still required to simultaneously do our part as fiscal institutional stewards in sharing in the contraction that is taking place in the broader context of the university. So this is shared pain by us all. So depending on the limitation of students on campus, we may find ourselves in a position where we are going to have to adapt to this in real time, as Jane mentioned earlier in her presentation. It is the leadership's goal here at the school to position ourselves to be as nimble and flexible as possible during what has been a difficult but ever-changing landscape for all of us. So in terms of what this means for us, when we look at issues on our compensation as well as non-compensation expenditures, we're not going to be able to hire in the way that we traditionally have. Our ability to promote our staff is very limited. We're seeing next to none in terms of increasing of salaries. And any of these requests that are put forward, I just want to say they are being highly scrutinized, not only internally by the school, but as well as the university. And this is not to say that we don't want to do these things, but in many cases, we may not be able to afford to do a lot of these things. There's a cost associated with every decision that we're making right now. Just briefly to give you an update from Diversity and Inclusion, the Diversity and Inclusion Action Plan is currently being circulated throughout Exec Committee right now, as we need to evaluate the position we want to put ourselves long term in light of the pandemic and the other pandemic that is currently occurring right now, of what we're seeing is being termed as the second civil rights movement in our time. We're trying to understand what the role of public health is going to be in this regard, and our school in this broader landscape. This Diversity and Action Plan, once it's gone through commentary through the Exec Committee, we are also going to share this for open commentary for the community, and this will likely take place in August. We really welcome all of the efforts and feedback that you guys have put in getting this plan up and running thus far, and continue to appreciate your efforts in formulating our strategy for the future related to D&I. We're working very closely with the ODECE office within the provost office to ensure that we are aware of the impacts of reopening, especially to our most vulnerable populations within our campus, and to proactively identify resources and guidance to provide to those that are in need of these resources during this time. in particular, a heightened interest on our underrepresented students, our essential workers at the university, as well as our faculty. Thanks to our faculty and PCH, the executive committee has approved a proposal to go forward to the Rules Committee on standing up a formal school-based D&I committee. Thanks to all of you who have responded to the call of action thus far. Right now, we are hoping that we can ask for faculty volunteers to be able to assist with the developing of this proposal to be reviewed by the Rules Committee. If you are interested, kindly reach out to the diversity email of the school with your interest. We really appreciate your time and your efforts on bringing this committee into the fabric of our school's operating norms. We've been working also very closely with Dean Walensky towards developing an inclusive training for our faculty. We're focusing on a number of key areas related to this in terms of the learner-centered classroom, inclusive course design, inclusive teaching strategies, as well as navigating controversial topics, just to be able to give our faculty a robust toolkit to be able to handle what is becoming a very dynamic classroom setting in light of the context we're all operating in. I just wanted to provide you guys with some of the contact infos for members of the operations team. And please feel free to reach out to us at any time on any request, and we will gladly support you in being able to navigate what is a very difficult time for us all.
Thank you, Dean Kazeem. In the interest of time, we're going to move right to Dean Hyder. Please know that this session is being recorded, so the questions in the chat that we don't get to at the end, we can respond via email. Over to you, Dean Hyder.
Thank you very much. Thank you, Natasha, for that. I want to recognize the time constraint, and so what I'm going to do is actually go very quickly through a series of questions. I first want to start by sending all of you who are here today positive thoughts on your safety, on your health, on your well-being, both in terms of remote access and in terms of obviously the trying times that we are in. So know that I am sending that to all of you right now. But let me quickly go through this, and let me add that even though we have less time today, please look forward. In a couple of weeks, we'll be holding another research webinar. And so I will have other opportunities to respond to any questions or concerns that you may have. But here are 5 questions that I have heard historically over the past couple of months, and I thought that it would be easier to run through this very quickly. First question I hear is, do we have reopening guidelines? And I'm hoping that all of you by now know that indeed we do. The current version is available on our website, as you see on the screen. It's available on the COVID-19 page of the Office of Research Excellence. And thank you to all of you faculty, staff, and students who participated in the development of those guidelines. And obviously, we will continue to update them. Second, so what is covered in these guidelines? Well, these guidelines focus on a number of issues, including those that Dean Kazeem mentioned, some points that Dean Goldman mentioned, but fundamentally, they provide guidance on areas around community-based research, clinical research, global research, laboratory-based and virtual research, in addition, obviously, to general guidance. And again, for those of you who are interested and you have your work in that specific area, please read that specific section so that you will be better informed. What I want to emphasize once again is very consistent with the message that you're receiving from every one of my colleagues, that in all of these guidelines, the health and safety of our community is of paramount importance. And this is consistent with GW guidance on this issue. Of course, our guidance is based on evidence and science, and I can't resist making a comment that not everybody follows science and evidence in this country in terms of guidance, but we do because we believe in it, we generate some of it. But at the same time, we have to be aware that we have to be flexible because we need to ensure that as new evidence, as new policies unfold, either at the GW level or the DC, Maryland, Virginia level, we are consistent with them. So another question is, are there forms or processes for reopening or restarting research? And the answer is absolutely. There is a 2-page form that is available on a fillable Word format. This form we are hoping to use, and we have already actually processed nearly half a dozen of these, thanks to all of you who have been participating in that, to approve your reopening, restarting, or of new research. We are hoping for a 7-day working day time turnaround. But of course, if there is something very urgent, if there is something that your donor needs or something is excessively important, please let us know and we will work with you. These forms fundamentally are asking you to fill in information about this 9 domains of information, all the way from identifying the project or study, all the way down to thinking about what if the pandemic becomes worse. What are your plans for closing down your study? Please remember that we expect every single research project to go through this if you're restarting it, if it's a new project, or in many instances, if it is required by your IRB. All of these forms will first go through the chair so that our chairs are aware and agree with your restarting and reopening of your research, and then we'll come to the Office of Research, and I will work very closely, depending upon space and operational needs, with Dean Kazeem to review this and provide approval and further comments. Please save these approvals because you may need them either now or in the future for other purposes as well. And the email for submission is on the slide. And then finally, a reiteration that researchers who are reopening lab space of any type, either in the 950 building or the School of Engineering, if you want to restart a research project that had been stopped, if you're doing a new one, or if you need IRB permission, it is extremely important that we understand that you will require this document, and we will work very closely with you to make it happen quickly. And then finally, I wanted to ensure that you understand that the GWIRB has also requiring that when folks are coming to them for IRB approvals or approvals to change major things, then they're requesting school approval. And our forms that are signed by myself and any other dean that is necessary will be the document that you can submit to them. We have also informed them about this and will be happy to work with you to ensure that you can get your research started. So please visit our website. Please be in touch with us. We are here. I just want to end. I've rushed through these quickly in the view of the time because I want to give a few more minutes for question answers. But I want to end by fundamentally thanking each and every single one of you, because I firmly believe that there is no research without strong faculty, without brilliant ideas, and your ability to apply to research grants and get our research funded. So thank you for what you do, and we hope that we'll be able to support that in the future. Back to you, Stacy.
Thank you very much, Dean Hyder. And it looks like we covered the questions in the chat that came in the interest of time. Dean Goldman and Dean Kazeem reached into the chat and answered some of those questions. So that's good. I think there was one question earlier that came up about the SEH and who would have access to it. So I wanted to just make sure we address that, and then I'll turn it back over to Dean Goldman for any final thoughts.
Thank you, Stacy. Regarding access to the SCH right now, we don't have that unrestricted access, but as many of you know, our 7th floor card readers, especially for some of our areas within our labs, does have restricted access. So we are still working with facilities to understand whether or not they are going to more globally restrict access and what that's going to look like. And I'll be sure to work with Adan in order to be able to get that communication and information back to our PIs.
That's great. Thank you so much, Dean Kazeem. And just again, as a reminder, this is being recorded and it'll record the chat. So we can, these have been great questions. We'll add some of the answers into the FAQs that Dean Thorpe will be putting out, and you will have access to that. So to you, Dean Goldman, for any final thoughts.
Yeah, I do have a couple. And I mean, first and foremost, of course, to thank the people who are in the panel with me for all their hard work. Natasha Kazeem, who just spoke, has been a tireless advocate for us through this, has been at our building every week, making sure that we have essential staff who are looking out for the well-being of our assets, our resources, that we're okay, that we're going to be ready to go back whenever we can. But I also need to thank each and every one of you. I know how hard you had to pivot on spring break, and I know that to no small measure, it was not only the training that was put together, but you actually attended the training. You're continuing to tune in, to be engaged. I personally am concerned, of course, primarily about the fact that each and every one of you, I want you to stay healthy. I want your families and your friends to be healthy through this. That is our number one concern. I'm also concerned that you're continuing to be able to have a nurturing environment at the school, not just for your health, but also your career, your continued path towards your objectives. And whether those have to do with the pedagogy, the teaching you're doing, and anything that we can do to enable that through the technology and other efforts that we have to do that, or if that is through the research that you're doing. And I will say that I've been very open to the efforts by our faculty who have needed to return to their research. Of course, some research just continued without a break during the whole episode. Some things had to go back to the IRB because you could no longer do face-to-face recruitment. You had to change how you recruit your subjects. But, you know, other epidemics like the HIV/AIDS pandemic doesn't go away. It's still important to save those lives. It's still important to help people stop smoking. It's still important to control obesity. And in fact, we're seeing that all of the problems that we work on, whether they have to do with racism in health and the social determinants of health, the environmental determinants of health, or chronic diseases, all of those come together into a set of risk factors that make coronavirus even more successful in being able to harm people. So I think that you know, we consider your work to be extremely important, and we want to do what we can to support that work. By the way, some of that I'm looking at, you know, Zoe just weighed in, policy. Look at how the policy environment is affecting this pandemic. The fact that we are the School of Public Health that prepared a Supreme Court brief to try to defend the Affordable Care Act from being eliminated by the Trump administration, which might happen, but nonetheless, I'm very proud of the work we do on policy. And I think that our policy context is why our country did not successfully join together at the early stages of this pandemic, and why we continue to have these resurgences around the country, because we did not unify when we needed to, and when we needed to all shut down and stop the spread of the pandemic. Instead, we allowed each community to make their own decision, which none of them were willing to do until they actually saw the pandemic up close. And then they were like, oh my God, this is real, we have to do something. And they're still doing it. So, you know, the lack of policy leadership and all of you, your work to make that happen, I can't even name all the names. But, you know, I turn on the TV and I see David Michaels and Melissa Perry, and I see Dr. Castell, I see Lena Wen, I see Jeff Levy. So I want to see more of Sarah Rosenbaum, frankly, you know, but I know that she's behind the scenes doing a myriad of things. These things are so important in this context. Our voice is incredibly important. And that means that, you know, we are continuing to be active, do our work. We had a record-setting quarter in terms of fundraising during the pandemic. Nobody else across the university can say that. And it's because of the fact that you are all energized. You are all full of fire to do the job that we do for public health. We have a record-setting fall, and with the admissions, and for the same reason, people across the country are set on fire for public health. Whether that means that they love us or hate us, that's a whole other thing. You know, now that they know who we are, some of them have decided they don't like us. Look at Tony Fauci. But it is an amazing moment for public health, and I just can't thank all of you enough for all the work that you're doing to allow us to continue forward. Thanks again to Stacy. Take a look at all the stuff that her team is doing. I mentioned all of that engagement with the media, with the world. It doesn't happen by itself. I can't be more grateful to Stacy DiLorenzo and her team for enabling us to have a voice in this. Thank you so much, all of you.
Thank you, everyone, for joining us this morning. We really appreciated your time, and we hope to be doing these again soon. So have a great day. Thank you.